Good afternoon, everyone. We'll go ahead and get started. It is 2 o'clock. Thank you for joining us for today's webinar, Reset and Recharge, Taking Care of Our Mental Health in Certain Times. My name is Caroline Stakoyak, and I'm the Program Coordinator at the National Volunteer Fire Council. I will be your host for today's webinar. Before we begin, as usual, just a few housekeeping items. We will have Q&A session at the end of the presentation. You can submit questions at any time using the Q&A box. I will keep track of your questions and we will answer those towards the end. Just as a reminder, if you were on the call last week or if you're new this week, we will not take any questions regarding the specific COVID-19, only questions regarding mental health. And this webinar is being recorded and it will be made available to the public via our YouTube channel. I will also send out the link after the webinar to anyone who registered for today's webinar. Just a quick overview of the National Volunteer Fire Council. We are the leading nonprofit membership association representing the interests of the volunteer fire, EMS, and rescue services. The NVFC serves as the voice of the volunteer in the national arena, and we provide invaluable resources, programs, education, and advocacy for first responders. If you are not a member, we'd love to have you join us. You can visit nvfc.org/join-NVFC. And now I am happy to introduce Ali Rothrock. Ali has been with us a few times to present, and we are certainly happy to have her back here today. Ali is a speaker, author, educator, and volunteer and advocate who has delivered over 500 presentations nationwide. Ali has been volunteering with the fire service since 2005, enjoying more than a decade as a firefighter and emergency medical technician. Ali is the CEO and lead instructor for On the Job and Off, an online platform dedicated to building more resilient first responders. And thank you again for joining us, Ali. With that, I'll give it over to you.
Hi, everybody. Let me just get my slides up here for you. I see so many people in this chat right now, and I'm just so happy to have you all here, whether you're sitting at your firehouse, you're sitting at home because you can't be at your firehouse. I know that we are all just dealing with some really uncertain times right now. So I'm happy that we can take this space just to kind of talk about what we might be feeling and what we can do about what we might be feeling. So before we start, I just want to talk a little bit about who I am and how I came to be the person who's talking to you today. Like you heard, I joined the volunteer fire service in 2005 and have enjoyed however many years it's been since then, 15 years, doing this awesome job of firefighting, which is something that I love very, very much. I've gotten to do a lot of different things in fire and EMS, really found a love for technical rescue, and have been fortunate enough to do that through part-time work and just through different organizations I've been a part of. And at the beginning of me being a volunteer firefighter, and if you've heard me speak before, you know the story well, but kind of the impetus for how I became the person who, talks about mental health for first responders and why I started On the Job and Off, really started on my very, very, very first fire call, because on my very first fire call, first time on a fire engine, didn't know anything about anything. My first call was a fatal car accident with a 5-year-old and her infant baby brother. And I remember, just like we all remember bad or traumatic calls that we've had, I remember so much about that call so clearly even now. And I remember being so eager to get back to the firehouse because I was so sure that somebody was going to tell me, okay, here's what we do with this type of memory. Here's what we do with this type of experience. Here's how we talk about it. Here's how we heal from it. And those conversations never happened, and they still haven't happened much in the last 15 years. We still don't do a good enough job on critical incident stress management. And so those experiences, both on my first fire call and on lots of other experiences that I've had since, really led me to be interested in talking about first responders' mental health. And another way that I got to be who I am now was through doing a lot of advocacy. I started my advocacy work lots of years ago as a domestic violence and sexual assault counselor, both being a counselor for people who were, living in domestic violence or had survived a domestic violence situation as a survivor advocate. And then I was also someone who would respond to the hospital to be with survivors of sexual assault to talk about their options and to kind of help them at the very beginning of their healing process. I took about 1.5 years of classes and training to become a certified trauma responder through the Association of Traumatic Stress Specialists, which is a national certification. I am one class away, one internship away, which I'm hoping does not get canceled, from having my psychology degrees specializing in crisis counseling. And I serve on a CISM team where I live in Pennsylvania, which I love very much and am very passionate about. And as you heard, I speak, I do all sorts of trainings and talks on first responder mental health. Like you can see that picture there. I got to do a TED Talk last year, which was very much a life highlight for me. And that top left corner is me kind of showing my best and favorite positive coping skill, which is something that I hope we all have now and are being sure to recognize what positive coping is for us and trying to put that into each and every day right now. That's writing for me. I mean, I can show you just right now sitting at my desk. This is my current journal. It says 87 on there because that's how many journals I have full. I write every single day. And that's something that has really been a positive thing for me over the last 15 years I've been in the fire service. And so all that education and all those experiences led me to be somebody who gets on stage and talks about experiences that I had in the fire service to hopefully get us to a better place and, get us to a place where fire stations are more welcoming and safer for all different types of people. And that kind of influenced starting this company that I run now called On the Job and Off, which does online and in-person mental health training. And as you can imagine, in the last couple of weeks, we've been scrambling to come up with as many resources as possible for first responders during this time. And so I'm really, really just always grateful for the NVFC for everything that they do for volunteer fire and EMS workers, and especially, responding to this pandemic in this way, making this webinar available for you. So let's talk about who we are as firefighters. I think both of these images, the left one, of course, from the wonderful Paul Combs, who I love, this kind of illustrates who we are. We are reliable. We think of ourselves as people who people can rely on to solve their problems, to make something better, to come into an emergency and fix it. And that's how we see ourselves. But sometimes, as we know, we can do everything right and still not get the outcome that we want. Whether that's on a really traumatic call, we do our very best, we get there fast enough, we do our job right, and people still die. That happens. And when that happens, that causes us to kind of doubt what we're doing and kind of who we are. And we're really seeing that right now in this pandemic where people are doing everything they know how to do. And there are still PPE shortages, and there are still people dying, even though we're doing the best work that we can, and that's taking a toll on us. And I really like this statistic, which we know, which we've heard, is that 1 in 5 people have mental illness, something diagnosable that they have going on, but 5 in 5, all of us have mental health, just like we have physical health. And we spend so much time talking about that 1 in 5, talking about people who might have a mental illness, and that's great and that's important. But I think that leads us to not so much focus on the other people who are supporting that 1 in 5. But just like we all have physical health, we might have days where we wake up and we have a headache or we have a stomach ache or we just don't feel well, we're sore, whatever. We might have days where our mental health doesn't feel as good as it usually does. And that's very, very normal, but we're not taught to think that it is. If we might be struggling with our mental health, we think, well, I don't want to be that 1 in 5. And that stigma is something that I'm working so hard to kind of try to decrease by talking openly about mental health. But especially right now, I'm talking to first responders all day, every day, who are struggling with their mental health, who just need connection. They need other people to talk to who can understand how much stress this is bringing to all of our lives, and then what we can do about that. So I want to talk about that today. So dealing with stress as a first responder during a global pandemic. Who saw this coming? Not me. I was ready for a very full spring of speaking engagements and trainings and keynote talks, and that's what I was ready for. And then all of a sudden, none of that's happening anymore. And I feel like a feeling that's being echoed is just how quickly this came upon us and how kind of irrevocably it changed our way of life. We are very much in this new normal, and this pandemic is not going to leave us as quickly as it came upon us. It's something that's really going to be a part of our lives for the foreseeable future, and understandably so. I think we're all having a hard time just coming to grips with the real depth of how much this is changing. And I remember watching the nightly news, world news, and seeing that nursing facility in Washington state that had so many cases and so many deaths, and just thinking, oh, that's so terrible for that area. And now that's happening almost everywhere in every state. I mean, thinking about New York, and they're putting bodies in refrigerated trucks on forklifts because they don't know where else to put them, let alone how that's affecting our family, kids who can't see their friends or their teachers, and they don't really understand why. All of this has come upon us so quickly, and we need to be really, really proactive about how we're going to take care of ourselves, because as first responders, we don't usually have the option of just staying home. We don't have that option. We have to be still going out and dealing with the public and putting ourselves at risk, and that's hard and that's stressful. And so what has changed? Everything, short answer. And what's continuing to change? I mean, look at these two pictures. These guys who are, protecting their airway and protecting themselves as they're practicing intubating a patient. That's weird. That's new. That's a hard thing to say, okay, this is now a part of my job. And that social distancing that we see, those pictures of people still trying to have promotion ceremonies and retirement ceremonies being 6 feet apart. You might have to wake up hours and hours ahead of when you were going to wake up to go in and disinfect your station, or to wake up before you come off shift to disinfect the firehouse for everybody else. You might have to get your temperature taken when you arrive at work or before you leave, or have decon procedures when you come and when you go. And then of course there's that fear of, am I going to infect my family? I'm sure you've seen the reports of people in the FDNY sleeping in their cars so they don't go home and risk infecting their family. This is in so many ways what feels like an impossible situation to continue to battle, but this is what we've been called to do. And so those changes are taking us by surprise, and we get to a place, like I know I've gotten to a place where I'm like, okay, this is the way that things are, and I'm going to get used to this, that we have to do. And then all of a sudden it's like, nope, all these other things happened, and now you have to get used to this. And so the constant changing makes everything feel really out of control, which it kind of is. And that could cause us to try to find control other places. And some of those ways are healthy, and some of those ways are not so healthy. So let's talk about stress. Fun topic, right? But I like this definition of stress. It says a state of mental or emotional strain or tension resulting from very demanding circumstances. That could be a bad call. That could be, just a fire call in non-pandemic times. But I would say that that is the definition of all of our lives right now, is stress. And so what are we doing about that for ourselves? Because our body can only take so much stress. I talk about cumulative stress, like we're all carrying a bucket around, and stress is like droplets in that bucket. And all of us have buckets of different sizes, and some of us already had droplets in that bucket when we came to the fire service, but we're all carrying a bucket around, and every new thing that happens is adding droplets to that bucket, and we can only hold that bucket before it overflows. And so what are we doing to empty that bucket, to release some of that stress? What can we do when we're isolated, when we're quarantined, when we can't go to the gym or go see friends like we normally would? And so let's talk about how that can impact some of our mental health. For my friends who have struggled with depression, self-isolating is something that they actively try not to do, because it's something that has made their depression worse in the past. And we know that when we're struggling with our mental health, we tend to isolate. And it's really hard when that's something that you're being forced to do, because we need connection. As human beings, we need connection. And it's hard when we can't do that now, or we can't have that in the way that we used to. You're going to see a bunch of links on these slides to great resources that I found. On the Job and Ops Facebook page has all of these resources linked if you want to go and look for them, or if there's any of them that you want to look into a little bit more. So we know that depression can be worse right now, or you used to struggle with it, but you've been much, much better lately. This could be a time when you start to see some of those things creep back in because you're being forced to be alone a lot. And my heart breaks for people who live by themselves because who are they supposed to hang out with? We all need that connection. And so now is the time to kind of get creative and use the technology that we have to force that connection, to make sure that we have it. You know, I know people who maybe they ran as a volunteer in a firehouse, and volunteers aren't allowed to come to that firehouse anymore. It's just paid staff. So all the volunteers will say, okay, we now have a daily Zoom or Google Hangout every day at 10 o'clock, and we're going to sit and we're going to drink our coffee and look at each other and talk. Or we're going to have, you know, a Google Hangout at 5 o'clock every day, and we're going to eat dinner and look at each other and talk to each other. That's something that we all need to be doing right now, because we can't just be alone in this, literally or emotionally. And then, of course, living through a global pandemic can trigger anxiety. Of course, these are anxious times for reasons that make complete sense. And so if you're someone that have struggled with anxiety and you've been, you know, better lately, this might be a time when you want to maybe call up your therapist if you haven't had a need to see them lately, and just ask if they can talk by the phone. Let them know how you're feeling, what you're doing about that, and see if they have any extra tips. And so we talk about depression and how, you know, we isolate when we're struggling with our mental health, and how we're being forced to isolate now. And for people who have struggled with their mental health and have been maybe brought to a place close to considering dying by suicide, now can be a really, really, really scary time for them. And the number one cause of suicide is untreated depression. And that's something that a lot of people are dealing with right now. So if me saying this makes like a friend pop into your mind, or a relative, or someone that you haven't talked to in a while, but you know that they were struggling at a time, even if it was a long time ago, take this opportunity to reach out to them and just see how they're doing, because again, we need that connection, especially now. And I love this picture. If you've seen me speak, you've seen it before. I love this picture because I look at this guy clearly standing on the wrong side, what I'm assuming is a bridge. And I look at, and like I count how many times someone has wrapped that rope around his body, and someone has his belt, and someone wrapped their belt around his knees, and they're holding onto his body. I look at all of those different times that rope is wrapped around, all those different points of connection. Those are all of the lifelines and resources that we have. We have all those different places that we can go for help, people that we can talk to, but we don't usually think of that until we get to a place where we're struggling. And I think, you know, in the beginning of this isolation, how, you know, some places were mandatory self-isolation, other people it was voluntary. Now it's kind of a lot more mandatory. In the beginning, everybody was like, cool, we're at home. I'm going to get home improvement projects done. I'm going to do this. I'm going to relax, whatever. And I think a lot of that is changing now, because people are seeing this isn't just relaxing time at home. This is forced isolation due to a global pandemic. And so we might need to reach out to some of those lifelines, to some of those connections, because we don't know how long this is going to last. And I kind of feel like we are all running a marathon, and we don't know when we're going to get to the finish line. We don't know when life is going to be able to return to normal. And so we have to make sure that we're taking care of ourselves and getting that connection for us, because we don't know how long this is going to last. And something else that I wanted to talk about that I've seen a lot of my friends and just people that I follow on social media start to discuss is how their relationship with food is being challenged right now. So if you are someone, or if you know someone who has struggled with an eating disorder or disordered eating in the past, a lot of that stuff is being re-triggered because we're craving control while living in a situation that's very uncontrollable. And so I don't know if you've heard of the author Glennon Doyle. She is a famous, New York Times bestselling author. She did an IGTV on her stories on her Instagram a couple of days ago, talking about how this is causing her relationship with food to be challenged. And I love what she had to say about what she's doing to take care of herself during that time. So if that's you, or if you know of someone who has struggled with that in the past and you want to just give them a little resource, but you don't really know what to say, maybe shoot them that IGTV, because it really helped frame it for me of how I can be a better resource and be a better support and comfort to my friends who might have struggled with eating disorders. And then staying sober during this pandemic is something that's being really, really challenged for people. Again, as we crave that control, we might struggle with or kind of relapse into old negative coping skills that we used to rely on when we needed some emotional comfort or control. And so if you find yourself struggling with things that you thought you had put to rest, just know that that's not just you. It's really, really common for people to be struggling with their sobriety right now, especially as, alcohol becomes not available or less available. I know that is maybe triggering for some people. So again, here are 2 great resources that I found of how other people are taking care of themselves, dealing with that specific thing. And I know that there are, AA meetings have moved online, NA meetings have moved online. The resources are there for you if this is something that you're finding to be a little bit harder right now. Then something that I'm really passionate about because of my past work in DV, we know that home is not a safe place for everybody. For all of us who've worked in domestic violence or have an awareness of that, that was one of the first things that I thought of when the mandatory self-isolation started to be enacted, knowing that there are plenty of homes that are abusive in the best of times, and these are not the best of times. And so by every metric, every hotline, every organization that is counting, domestic violence rates are skyrocketing right now because people are stuck at home in abusive situations. And again, these are not the best of times. So there's extra stress because of job loss and financial stresses. And so we, as everyone who is aware of this problem, we're really, really, really concerned for people who are stuck in those environments, who they don't have an ability to get out of the house anymore. But that being said, there is still help, especially now, because we know that things are extra bad. And so if you're able to Google search, a quick Google search of, domestic violence help, and your town will get you a hotline, will probably get you a domestic violence shelter, most of which are still open right now. If not, there's still help. There's a link right there. futureswithoutviolence.org has some great resources. And then again, this is linked on my social media. So even if you can't leave, there are still ways to safety plan, and calling any domestic violence hotline and telling them you need help safety planning, they can get that help for you. So if that makes you think of yourself or anybody that you know that has been in an abusive situation in the past and you're worried about them, if it is safe to do so, please, please, please reach out to them. And a point about being home, again, I think in the beginning, and I certainly had this thought of, oh, everything came off my calendar, I'm going to now have a bunch of free time, and I'm going to get all these things done that I probably never would have gotten done otherwise. And I think that changed pretty quickly for all of us when we realized the scope of what we were dealing with, and whether or not you can stay home or have to go to work. If your kids are now home and you have to entertain them every day, if you have a spouse, their work environment might have changed. Our home time right now is not free time. I mean, you're not home on vacation. You're not homesick and get to have a sick day. You are forced to stay home because of what's going on in the world. And so people need different things right now. Some people who are being forced to stay home, they made a routine for themselves on day one, and they have stuck to that routine, and they need that routine and that structure to help feel like this isn't so out of control. For some people, they don't want a routine because that routine is going to be broken, and that's more anxiety producing for them. So that's fine too. The biggest thing is to just try to release expectations of things being normal, as in how they were 3 weeks or a month ago, because times are not normal. We don't know when they're going to get back to normal. And so just releasing those expectations of anything being normal, because they're just not. And again, having a routine that's different than it used to be, or a routine that has to change because things keep changing, that might be more stressful for you. So then don't worry about it. Just tackle what you can in the day. And releasing those expectations of productivity. I'm sure you've seen on social media, as I have, people talking about everything they're getting done in the day and their home workout routines, and they're starting a podcast and they're finishing this project. And that's great if that is helping them. I'm being very productive during this time. But for some people who have increased stress, being productive isn't the best for them right now. They need permission to not be productive and to just get through every day the best that they can. So that's okay too. And Glennon Doyle, the author that I spoke about, who talked about challenges with food on her Instagram, she has a lot of great stuff to say about just giving yourself permission to not be productive right now. Because again, we're not home on vacation. This is the most stressful time that a lot of us have been through. And it's okay to just get through it the best way that you can. And along those lines, being gentle with yourself. You're going to have, mood changes. You're going to have moments where you're kind of resigned to what's happening and you're like, okay, I can't do much about this. And then you might, in the next moment, be really, really fearful or angry or overwhelmed. All of that is okay. And all of that is normal, because we are all trying to come to terms with what this is and what this means for us as quickly as possible. Something that's been helpful for me is recognizing news oversaturation. So of course we need to be aware of what's going on, and we need to be up to date with all information that we need to know for ourselves and for our family. But there becomes a point, and it's a line, and it's different for all of us, when we're not learning anything new from social media or the news. All we're doing is oversaturating ourselves with all of the bad stuff that's going on. So recognize when you're there, when you're being oversaturated, you're not learning anything new, and take that opportunity to turn the news and social media off. And healthy distraction is perfectly okay. So I've been binging The West Wing on Netflix as I write, which is probably something I never would have watched before, but it's a show that's distracting to me, and that's healthy. It's not hurting me in any way. And so that's something that I'm just using to kind of take my mind off of things as I sit and work in my office. And so that's okay for you, especially if you have kids. It's okay to just distract them in healthy ways. And keeping that perspective, everything feels like the apocalypse right now, but it is not going to last forever. There is going to be a day when we can be out in the world around each other again. And what a great day that's going to be. And so make your plan for what you're going to do on that first day. Where you're going to go, what restaurant are you going to eat to? Are you going to go to your friend's house and give them a giant big hug? It's not going to last forever. And so thinking about what you're going to do after can help keep that perspective in a good, healthy, hopeful place. And helping others makes you feel not so helpless. So that could look like, walking your neighbor's dog, or donating blood, or, organizing a neighborhood dance party that I've seen people do every day at 5 o'clock. They all come outside and 6 feet apart, stand and dance with each other. And it helps them all. So helping others makes you not feel so helpless in whatever that is able to look like for you. And for a lot of us, our job, being a first responder, is helping others. And so we're able to still help people and be with people and have that connection during this time. And, we talk a lot about bad news and that bad news oversaturation. But John Krasinski, who played Jim on The Office, he just started something on his Instagram called Some Good News. And he is compiling all the good news that is happening right now. So it's people helping people, people coming together, people going above and beyond for neighbors and people who they don't even know. So that's helped me just look at some of the good stuff that's happening right now. And so again, that's linked on my social media, or you can just go to his Instagram and check it out. So I want to talk about this acronym FIRES, which I usually use talking about critical incident stress management. So like if you come back to your station after having a really bad or traumatic call, what are the things you can do to be taking care of yourself? But I've kind of adapted it to just stress management, because again, the time we're living in right now is incredibly stressful. So this is an easy acronym to remember. And as I talk through each letter, I want you to think about what does each letter look like for you, and how can you be incorporating some of these things into your life right now? So F is first acknowledge, and that could be the most important one of all of this, is acknowledge that this is having an impact on you in whatever way it is. You're stressed to go home. You're stressed to hug your kids because you don't want them to catch this. You're stressed to go outside. You're afraid for friends and family. You're afraid for the world, for the economy, all those things. Acknowledge that it's having an impact on you, because wasting time and energy pretending like you're fine or telling yourself that you're fine is not helping anybody. So acknowledge that this is a thing. Then I is initiate resources. I know all of our resources are strapped right now, but after a critical incident, that could look like having a CISM team deployed or talking with a peer supporter. Those things are still available now. So whatever resource you think you need for your mental health, is it finding an online AA meeting? Is it calling up a counselor that you used to have a lot of years ago and just talking to them? Whatever that is for you, now is the time to do those things. R is respond to what you need. So that could be, maybe you've been working a bunch of days and you're exhausted and you need to go home right now. Maybe you need to take a shower. You need to have a good meal. You need to just sit with your spouse or your friend or whoever and just talk about what's going on in the world. Whatever you need, even though we're all living crazy days and working a lot of hours, that bucket is going to overflow at some point. So how are we responding to what we need right now? And E is expend stressful energy. Again, we're all feeling the stress. And what are we doing with that energy? So even though all the gyms are closed right now, we have to get that energy out somehow. And so for some people, getting that energy out could look like writing it out, what you're feeling, documenting what's going on. Or it could be, going for a run, which we're all still able to do, or go for a hike or whatever, but that energy has to get out somehow. And then S is spend time away, which is a really hard thing to do right now. After a bad call, leaving the scene or leaving the station could be spending time away. And right now, after a bad call, when you leave the scene or leave the station, you're giving yourself a break from that environment. You're getting, yourself away from that, and your body's able to process what you saw. But now you're going home into an environment that is equally stressful. And so figuring out how can you give yourself that downtime and that mental break from not thinking about this constantly? So maybe that is watching a movie or, going for a long walk and listening to a podcast. You need to find a way to take a break from feeling constantly stressed. And that's going to look like something different for everybody. But it's something that we need to be doing now, because again, we don't know how long this is going to last. And so taking care of ourselves now is really, really crucial. So just talk a little bit more about on the job and off, the resources that we have. Here are the 6 courses that are available up on our platform right now. If you or your firehouse needs some more mental health support, here are all the courses that we have dealing with. 4 are primarily mental health. 1 is addiction, and the other is addressing sexual harassment, sexual violence in the fire service. I'm really so fortunate and happy to have an online platform right now, which who saw a pandemic coming and saw that this would be the only way people would be able to train. So it is there for you if you want to take a look at that. And then most importantly, I want to talk about an additional resource that we can offer. On the Job and Off partnered with Banyan Treatment Centers. They have 11 locations nationwide, and they deal with people who need to come in for primarily mental health stuff, primarily substance use stuff, or if you're dealing with both. And that phone number right there in red, that is a number specifically for you guys to use if you want to call into Banyan and just see like what kind of insurance they take, or what an intake process would look like now, or just see if they can help with whatever you have going on. So please, even put that number in your phone because you might want to give it to somebody later. That resource is still available for you guys right now. So I encourage you to call it if you just kind of want to talk and see what kind of help they can give you. And so I think now it is time for our Q&A session. Let's see what things have come in.
Thank you, Ali. Yes, we will start our Q&A session now. So if you have any questions, you can enter those into the Q&A box found within your Zoom screen or enter them into the chat. So I had a question for you, Ali, just to start things off. Do you have any suggestions? You know, as you mentioned, we are home with family members. Some of us may have children at home and we're not used to having children at home, or husbands or other family members. Any suggestions for dealing with family when we're around them more than we're used to?
Yes. And that is certainly can be a stressful situation. Absolutely. Honestly, I think something that would really help is to openly talk about how it's hard. And even with kids who, as little as they are definitely feeling the stress, or at least know that something is different and they can't go outside and stuff. So I think talking about that and making sure that everybody is okay with saying, like, I need some alone time right now. You know, even if you don't live in a big space, clear out space in a closet and be like, I'm going to go and sit there and close the door and nobody talk to me for 20 minutes. I think that's something that we need to be okay with saying, because we are just kind of thrown together for an unknown period of time. And again, healthy distraction is okay. So I've seen parents say, you know, we usually try to limit screen time for the kids, but none of that counts anymore because it's a pandemic. That's okay. You know, it's not going to harm the kids in any sort of long-term sense. So I think just kind of doing whatever you need to get through this time is perfectly okay.
Great, thank you. Great suggestions. So our next question, how do you convince a department leadership to take mental health seriously where there is complete denial?
Yes, I get asked that question, it sounds like 50 million times a day, because everybody is dealing with that, unfortunately. There's not like a blanket answer that's going to work for every situation. People are in denial for a lot of different reasons. Maybe their own mental health needs some help and they aren't willing to look at that. I've seen that be the factor a lot of times. But I do still think a lot of chiefs and people in leadership think that dealing with their first responders' mental health is not their problem. And I think it can take maybe using some outside resources or showing what other people are doing to deal with first responders' mental health makes it feel like not such an overwhelming thing to tackle. If you can say, like, look, you know, we can have this resource, or we can, you know, bring somebody else in to talk about this. That's one of the reasons why On the Job and Off works really well, I think, is because it's an easy solution where you don't have to logistically arrange for people to come in and speak. You just get your members access and then they can go on and take whatever courses and get resources that they need to. I hate hearing that every single time I do, because to most of us, it's such a no-brainer. Like, why would you waste time being in denial about something that is obvious? But I think it sometimes takes somebody else saying it other than you, and I'm happy to be that person if you want me to have a conversation with anybody, or giving just some other resources to say, look, here's what other people are doing. But I've seen people have a lot of success in those situations where maybe like your chief is never going to get on board. He or she is just never going to get on board, but you can form a little group of people, whether it's line officers or not, to say, okay, you're not going to pay attention to this. That's fine. We're going to get together and we are going to learn how to better support our fellow first responders, or we are going to take it upon ourselves to get those resources. Sometimes you can kind of go around roadblocks like that.
Thank you. The next question, have you seen any changes in your department in terms of mental health or stress and how that's been handled?
Like specifically now?
Mm-hmm.
Probably. I think it depends. Like the departments in my area, some of them are taking this really seriously and some of them are not. So some of them have, like, you get your temperature checked when you come and go, and no more volunteers or visitors at the firehouse. And in those stations, I've seen the stress levels be a little bit lower because it's clear that like people are paying attention to this. In the stations where it's just kind of more or less business as usual, I think the anxiety is much higher because people feel like they're not protected, or that nobody's paying attention to them. So yeah, and it's kind of depends on what the leadership is doing. And I mean, leadership in my area, most of them are taking it seriously, but some aren't. And some departments just have a stronger bond than others who are already willing to talk about stress and stuff. So those places I've seen are dealing with this better because they've already kind of broken down those barriers with each other.
Right. Great. Thank you. Next question we had come through. What advice would you give volunteers who are struggling with anxiety over responding to those calls? And, should they have to respond? And, some states now have that shelter in place order, and how do you navigate that?
Yeah, I mean, I think that's a personal choice. And if you're a volunteer, nobody's making you go. And of course, we all feel that desire to go. We want to go and help. That's what we signed up to do. But I mean, I know plenty of people both in fire and EMS that have said, I didn't sign up for this. Like firefighters say, I signed up to go to house fires and cut people out of cars. I did not sign up to be on the front lines of a pandemic. And so for them, they're out. They're not responding anymore. There are some volunteer stations that they don't exist anymore. They're not functioning. And so I think it's a personal choice. And I don't think anybody would fault you if you needed to take care of yourself and maybe not respond for a while, because there's no way to know if you're going to respond to someone who is sick or not, or if you're going to get it or not. But I think something that could help with anxiety is talking to other first responders who are in that position and maybe see how people in your station are feeling, or if you have friends in the service, just see like, what are you doing? What are you doing to help yourself in this time?
Perfect. Thank you. Next question we have, so I'll read it. We are social creatures, some more than others. There are members who spend countless hours at the firehouse because maybe they don't have any family around, and find it hard to engage online. Do you have any suggestions for keeping people engaged without crossing that line?
Sure. I mean, it depends on what line you're talking about. If it's like social etiquette lines, or like maybe you're not super good friends with them, but so you don't want to cross that line, I would say ignore the line. The line doesn't exist because it's a global pandemic, and we have to do more than we normally would in non-pandemic times. So I totally get that. I know a ton of people that maybe don't have family in the area, so they're at the firehouse all the time. Those are the people that we want to be checking on the most. So maybe it's something where you say, hey, like at noon tomorrow, let's FaceTime. And it can be for 5 minutes, and you can just talk and see how they're doing. And of course, people have to want to engage back. And so that might be something that they just don't want to do. But I think you can kind of do all you can and use the technology that we have to try, because that's our only option right now. So we have to be trying to do those things that we might not normally do in non-pandemic times.
Great. Next question, do you think the stress level between responders and the public is different?
I would think so. I think the civilians have the option to stay home. And of course, everybody has their own stresses with job loss and financial things. But if you have the option to stay home, I would think your stress levels would be a lot lower. And also, I think there's a certain sort of ignorance through the fault of nobody, where if you aren't seeing this stuff every day and your work environment does not include the stress of COVID, then I would have to think your stress levels are a lot less, because you can kind of just pretend that you're just home because you're just home for a while. So I would think that the stress levels are a lot different. Yeah, I would say so.
Yeah, that's a great point, Ali.
Good point. Yeah, that was a good question.
This individual asks, what do you think is the biggest cause of stress dealing with the pandemic? Stress from the change of routine or the fear of the pandemic itself?
I think the biggest cause of stress is the fear of the unknown. Because say someone could tell us it's going to be really weird and really bad, but on May 1st, everything is going to be back to normal. Or July 1st, everything is going to be back to normal. If there was a known end date to this and someone could tell us the exact ramifications of this, then we would know what we were dealing with, and we would know what we would have to get used to and embrace as our new normal. But I think the fear of the unknown is what's causing so much stress. And like in the fire service, say the house right there was on fire. That's where the danger is. If I'm over here, I'm not in danger anymore. But now we don't know where that danger is. We don't know where the virus is. We don't know who has it, who's a carrier. Am I going to get it? Am I not? So I think all of that fear of the unknown, which nobody has the answers to any of that, is what's causing so much stress right now. Because even if it was going to be really bad, if we knew exactly how bad and when it was going to be over, I think it would be a lot easier to deal with.
Yeah, I agree with that. The next question is sort of related to one that you've answered, but do you have any advice or opinion on departments that are ignoring sort of the pandemic? And you talked about with departments who are sort of ignoring those mental health issues, can you get together with fellow first responders? Do you think you could do something similar in this situation?
Absolutely. I think in this time, and really any other time, if your leadership is refusing to act, whether they are not taking the pandemic seriously based on like social distancing stuff, or they're not taking the mental health needs seriously, you have to take it upon yourself. Unfortunately, you have to take it upon yourself to do those things and to either like disinfect stuff when you can, or to take it upon yourself to say at 5 o'clock tomorrow night, we're all going to sit around on FaceTime and we're going to talk to each other. You might have to take it upon yourself if your leadership, for whatever unknown reason, is still not taking this seriously, because you have two options. You can sit there and be mad at your leadership for doing nothing and keep, putting yourself in harm's way or not taking care of your mental health because they're not. Or you can take ownership over the situation and say, I'm going to do what I can to protect myself, whether that's through disinfecting stuff, social distancing, or taking care of your mental health. So I would say it's time to take ownership of the situation and do what you can in your circle of influence, and just do what you can.
Yeah. I'm not seeing any additional questions come in. So if you do have any more questions, if you could submit them now. And while we're having maybe a few more individuals enter their questions, I just want to thank you for the news oversaturation. I had a little bit of that last week and I didn't even realize what it was. And then when you mentioned that, I was like, wow, that's such a good point. And
yeah,
there's so much coming in, it's hard to process everything.
So much. And I know, like, for me, if I would have downtime or if I would be like trying to unwind, I would go on social media, and that I have my social media in such a way that I'm seeing like dogs and pictures of things that make me happy. And now social media is just more of the bad. It's those headlines, it's all of that fear. And so it's not a positive thing for me anymore. And so, yeah, I had to recognize like, oh, I'm done for the day and I'm going to watch The West Wing or read a book or whatever. So yeah, that news saturation is huge. And I don't think we're realizing what that is and that we can control that part of it.
Yeah, exactly. And we did have one more, one more question come in. Could you expand on the balance of finding control when we're feeling that things are out of control?
Yeah, and that's so hard because I can't sit here and tell you that things are in control, because they're not by any stretch of the imagination. And I think finding control through having a routine, even if that's really loose, or controlling how much news you're absorbing, or controlling, how much interaction you're having with people through technology. That's good. That's a good way to practice some control in this. Control when it comes to using negative coping skills or negative things that are hurting us, like controlling or restricting food, or going back to drugs or alcohol. That's control in not so good of a way. And I think we all have, like, even just in our own mind, we know what's helping and what's not. And again, turning to those negative things you're not doing anything wrong. There's nothing wrong with you. It just means you're turning to what you know has helped in the past. And so if you are turning to some of those things, you are not alone. A lot of people are dealing with some things coming back up. So just make sure that you are paying attention to resources and talking about what you're feeling.
Great. Another question came in specifically on a chief's stress. So chief may be dealing with some additional stress as well.
Yes. Good question, Jonah. Yeah, I mean, chiefs are always dealing with a different type of stress, an additional stress than everybody else. I think it's, above all else, making sure that you are figuring out how to spend time away from dealing with this, even though I know every chief's phone is ringing off the hook and they're trying to get more PPE, and I know that downtime can be very limited, but you especially need to give yourself permission to turn off for a while, whatever that looks like, because that's the only way this is going to be sustainable for any of us. And I think trying to find other chiefs that can kind of commiserate with you and who you can just vent to about stuff that only chiefs can understand, about that pressure and that responsibility. And you might even find some ways that other chiefs are figuring out to spend time away, or other solutions that they have found that could be really helpful for you too. And I think with all of this stuff, like, we don't have to reinvent the wheel. We can talk about what we're doing that's helping. And that's why I'm so passionate about getting all the stuff just out that we're doing, because we don't know who it can help. So I would say, figure out how to get that downtime for yourself, whatever that looks like, and then try to find other chiefs that you can talk to see what they're doing to help themselves.
Great advice. The last question that I'm seeing right now, for departments that have multiple stations, they're now quarantined away from each other. Any recommendations on how to keep the firefighters at the separate stations united?
Yes, that is such a good question. An image comes to mind that I saw on social media recently. Was a couple of people who live in a neighborhood. This would be kind of different now with mandatory stuff, but they all just kind of like drove into an empty parking lot, backed their cars up to each other 6 feet apart, and just like sat in the trunk with a blanket and a cup of coffee and just kind of yelled at each other to kind of stay connected in that way. And so I'm wondering if it would be possible to do something like that, where you're maintaining social distancing, but you're just getting to be in the same space, maybe do it outside. And then I think using technology has got to be something that that you put into place right now. Having a, department Zoom call where everybody gets on at their own stations and or at their own houses or whatever, and maintains that contact. Start a big group chat with everybody, like whatever makes sense for you. Like I've said a million times, connection is what we need now. And through technology, we can get it, even if it's a little bit differently and not all the way ideal. And I know a lot of departments and stations that are separated, and they're doing, through technology, they're still having like, Monday meetings or monthly meetings or whatever. They're just doing it virtually. So I would say, figure out how to implement that for your people, and then do it like every other day or every week, and just say at this time, like every Tuesday and Thursday, 3 p.m.
Yeah.
Here's the link. We're all going to be in there. Let's come on and talk to each other.
Perfect. Great. Yeah, I also heard of people creating separate Instagram accounts, and then you invite the individuals that you want to be a part of that group, and then you sort of share pictures of what you're doing throughout the day.
Exactly. Yeah. I mean, I know people that are having like board night in their neighborhood and somebody has like the, you know, whatever, chutes and ladders. And it's like, okay, where do you want me to move you? Like, it's silly, but it's what we need right now. So whatever that looks like for you, figure it out, do it.
Perfect. All right, I'm not seeing any other questions, so we'll give it just another 30 seconds or so, see if anything else comes in.
And if anybody has any questions that you think of or that you didn't want to ask right now, please feel free to email me. It's Ali, ALI, @onthejobanoff.com. I'm happy to answer any questions there or provide any additional resources, or you can just go to onthejobanoff.com to see what resources we have there as well.
Yes, and I will move to it in a moment. We do have Ali's email address on the next slide, I think, or the following. And with that, you know, I will start that conversation on volunteer voices. If you think of anything after the webinar that you'd like to talk with your fellow first responders about, you can join us at Volunteer Voices. And here is Ali's contact information. If you have any questions for her, as she said, you can email directly. You can also email me if you have any questions. As I said in the beginning of the presentation, this webinar has been recorded and we will send that out to anyone who registered today. All right. Well, with that, I just want to thank you, Ali, again for joining us, and thank everyone who joined us on the webinar today. Just a reminder, when we close the session, a survey will pop up. So if you wouldn't mind taking that survey, let us know how we're doing on our webinar series. We would really appreciate it. All right. Thank you, everyone.
Thanks,
everybody. Have a great afternoon.
Stay well. Bye.
Bye.